Dystonia is a neurological movement disorder characterized by sustained or intermittent muscle contractions, abnormal postures, or twisting movements. These involuntary movements can cause significant discomfort and interfere with daily activities. The severity and distribution of symptoms can vary widely among individuals. Types of dystonia: focal dystonia affects a specific part of the body. Cervical dystonia, spasmodic torticollis, involves abnormal neck muscle contractions, leading to twisting or tilting of the head. Blepharospasm affects the muscles around the eyes, causing involuntary blinking or eye closure. Writer's cramp affects the hand and forearm muscles, causing problems with writing or gripping. Segmental dystonia involves two or more adjacent body parts. For example, both the neck and shoulders may be affected. Generalized dystonia affects multiple parts of the body, often starting in one area and spreading to others. Task-specific dystonia occurs during specific activities. For example, musicians might experience dystonia affecting their hand or arm while playing an instrument. Hemidystonia affects one side of the body. Primary dystonia, not associated with any other neurological or medical condition. It is often hereditary and can be idiopathic, no known cause. Secondary dystonia results from another condition or injury, such as neurodegenerative disorders, e.g., Parkinson's disease, brain injury or stroke, infections or tumors affecting the brain. Symptoms: involuntary muscle contractions, often painful and can cause abnormal postures or movements. Abnormal postures: muscles contract in a way that distorts the affected body part. Twisting movements: repeated, uncontrolled movements that can interfere with normal function. Tremors or shaking sometimes accompany dystonia, particularly in the limbs. Difficulty with voluntary movements: tasks like writing, walking, or speaking may be challenging. Causes: the exact cause of dystonia often depends on the type and may include genetic mutations. Many forms of dystonia are inherited and linked to specific genetic mutations. Neurological conditions: secondary dystonia can be caused by other disorders, such as Parkinson's disease, Huntington's disease, or Wilson's disease. Brain injury: damage to the basal ganglia, a group of structures in the brain involved in movement control due to trauma, stroke, or infections. Medication side effects: certain medications, particularly antipsychotics, can induce dystonia. Diagnosis: diagnosing dystonia typically involves medical history, reviewing symptoms, family history, and any potential causes such as recent injuries or medication use. Neurological examination, assessing movement patterns, muscle tone, and posture. Imaging studies, MRI or CT scans of the brain to rule out structural causes or secondary conditions. Genetic testing, in cases where the hereditary form of dystonia is suspected. Blood tests, to check for underlying conditions or metabolic issues that might be contributing to the symptoms. Treatment and management: treatment for dystonia focuses on reducing symptoms and improving quality of life. Strategies may include 1. Medications: anticholinergics, e.g., trihexyphenidyl, benztropine, help reduce muscle contractions. Botulinum toxin injections: botulinum toxin Botox can be injected into affected muscles to reduce spasticity and involuntary movements. Dopamine agonists: medications used for Parkinson's disease, such as levodopa, may be effective in some cases. Muscle relaxants: medications like baclofen can help ease muscle tension. 2. Physical therapy: exercises and techniques to improve posture, flexibility, and motor function. This can help manage muscle stiffness and maintain mobility. 3. Occupational therapy: strategies to assist with daily activities and adapt tasks to improve functionality and independence. 4. Speech therapy: for individuals with dystonia affecting speech or swallowing, therapy can help improve communication and swallowing function. 5. surgical interventions. Deep brain stimulation (DBS), an option for severe cases where electrodes are implanted in specific brain areas to regulate abnormal electrical activity. Pallidotomy, surgical procedure that involves creating a lesion in the globus pallidus, the brain area involved in movement control, to reduce dystonic symptoms. 6. Lifestyle adjustments, stress management techniques, relaxation exercises, and lifestyle changes can sometimes help reduce the severity of symptoms. Coping and support groups. Connecting with others who have dystonia can provide emotional support and practical advice. Education. Learning about the condition and available treatments can empower individuals to make informed decisions about their care. Counseling. Psychological support or counseling can help manage the emotional impact of living with a chronic condition. Conclusion: dystonia is a complex movement disorder with a range of potential causes and treatments. While there is no cure, various approaches can help manage symptoms and improve quality of life. An individualized treatment plan, developed with the help of healthcare professionals, can address the specific needs and challenges of each person with dystonia.